Hi, everybody. Thanks for joining us today. This is an exciting provider roundtable after, I think, a couple of months on the back burner with the holidays. So we're excited to kick off 2022 with Ravi Jaishankar. And Ravi, hi. Thanks so much for being here. You've done an incredible amount for our organization and helping us understand mental health scholarships. Um, Ravi works for Building Hope in uh, in Summit County, Colorado. And let me tell you a little bit about him. Ravi joined Building Hope in April 2019 after a corporate career with AT&T, where he worked as an information technology and business management professional. Originally born in India and raised in New Jersey, he graduated from Rutgers University in 2010 with a triple major in IT, psychology, and religion. Ravi arrived in Summit County in late 2016 to pursue his passions, deepen his commitment to health and wellness, and discover meaningful life. He enjoys snowboarding and skiing, biking, motorcycling, backpacking, and hot springs, and he has worked to cultivate a meditation practice, which he has expanded to teaching yoga, philosophy, and meditation classes. Ravi's role at Building Hope is multifaceted. It includes helping people get connected to the mental health services they need and managing the mental health scholarship program. Ravi also manages the innovative insurance billing program that incentivizes providers to accept insurance. His other work touches on various aspects of care coordination, community collaboration, and implementing new programming. Ravi, thank you so much for joining us today. We're excited to hear about your experience with mental health scholarships as we here at Connect start to roll out our mental health scholarships. And my name is Julia Sambrat. I'm the executive director here at Connect, and I'm really excited. This is my first provider roundtable. And so thank you all for joining us. So on that note, Ravi, let's just launch right in to all of your expertise and share the ins and outs of your scholarship program.
Absolutely. Thank you so much for that gracious introduction, Julia. And thank you, Rachel and Catherine, for facilitating this. Really excited to be here. I am, just honored to be of service to Summit County, Utah, twin sister county. So very, very happy to see you all doing some really great work to make mental health services more accessible to your community. And that's really what our mental health scholarship program is about. Building Hope is a 501c3 nonprofit organization, a grassroots community organization that started in 2016 after a really tumultuous time in Summit County, Colorado. We had a series of high-profile suicides that rocked the foundations, and people really came forward to say, we have to do something, we have to build something. And so Building Hope sprang out of that. The primary aspect of our scholarship program is to address the main issue, which is cost. Ultimately, health insurance, perhaps there's a high deductible that needs to be met. Perhaps people can't afford health insurance, their employer doesn't provide it to them, or they make too much to qualify for Medicaid. Maybe they don't know, or they don't have an employee assistance program. So there's several scenarios where people cannot access mental health services in an affordable way. And so the access piece is really where we wanted to change things. And just really happy to be able to help Connect Summit County in developing a similar program to ours, and just learn from everything that we've done in implementing our programming around providing these access scholarships for mental health, for therapy services. So once somebody comes to us and says, hey, I'm looking for a therapist, and I heard you have some charitable funding that I could potentially use, we vet their payer sources. We always check if they have viable or adequate insurance, and we do refer out to that if they have a standard copay that doesn't apply to their deductible, for example, or if they do qualify for Medicaid, they didn't know that they did, we get them signed up for that and we refer to a Medicaid provider. But again, you know, in all those instances where there isn't a viable way to pay for services, we go ahead and issue a mental health scholarship. And that scholarship essentially entitles the client to 12 sessions of therapy. And, you know, different programs have different numbers. So I'll be curious to see what Connect does with their scholarship program specifically. You know, the eligibility criteria might be different. The logistical process and the referring process might be different, but ultimately, you know, the individual receives a voucher of sorts that will cover a certain number of sessions with a provider. What we've done is we've made it really, really simple and straightforward for both the client and for the therapist in terms of each side being able to essentially utilize our program. So once the client is approved, you know, we collect some basic information from them. We provide some basic resources in addition, but that voucher number, again, is that ticket to their therapy. And they reach out to our network of providers, and we have a network of actually up to 60, I believe between 60 and 70 providers at the moment. We are networked with our local federally qualified health centers, our mental health clinics, our community mental health center, in addition to a large amount of local private providers. One of them you'll be hearing from a bit later. She'll be joining soon and kind of providing her experience with the scholarship program here. But we do have a very positive relationship and have become kind of a convener of mental health providers in the process. We offer trainings, we offer social networking events on a quarterly basis, and we offer, you know, opportunities for providers to get together for reflective supervision and sharing office space. You know, providers have just been able to really network through us, which has been a really wonderful side effect of our scholarship program. And, you know, in the beginning, we started off with just a few providers, but it really spread through word of mouth in the provider community, saying, hey, have you heard of Building Hope's program? You should become a scholarship provider. And so we went from just a handful of providers up to, you know, now in the high 60s. So just some notes, just some data points on our mental health scholarship program. We've offered close to 2,000 scholarships in the past 3 years, and we're very proud of that. We offer between 300 to 400 therapy sessions a month that we pay for. Of course, as I mentioned, we try to make it as easy as providers as possible, as easy for providers as possible. We have a very simple invoicing process, which is a Word document that is kind of a chart that's filled out to just note the client's initials to protect their privacy, their voucher number, to identify them, and of course the dates of sessions. And we just track how many sessions are being used, up to 12. And then that we do pay once a month. So, you know, Connect's process could be similar. You know, there could be some nuances, but again, we're just working close on just determining, you know, what that process will look like for Connect. We also have expanded our services to psychiatric services. So either a psychiatric nurse practitioner or a psychiatrist. We offer specifically 6 hours of time for that. We also offer psychological evaluations or psych testing services as well. And we have BCBAs for neurodiverse or neurodivergent populations as well in our offering. The main thing that we don't pay for is medications or prescriptions. So I'm not sure where Summit County, Utah or Connect will draw the line, but you know, that's kind of where our services extend to. We even have a process to request additional funding in more acute or severe cases. You know, sometimes as a provider, you get 12 sessions to work with a client, that's great, but you don't know if you're opening up Pandora's box in that process. The client potentially might not know that they have some pretty deep trauma that they have to work through. So in cases where that comes up, or in cases where, perhaps EMDR takes a little bit more time, et cetera. In cases of play therapy or working with adolescents, that sometimes people just need more. We do have a request for extension process. And we certainly advocate for clients to get that level of care that they need to really be able to get on their feet. Of course, all that being said, we do emphasize solution-focused brief therapy. We do emphasize kind of empowering the client with the tools that they need to manage their own mental health, and that it is a short-term intervention and it's not meant for long-term support. We have, explored renewing scholarships, but right now we just do limited extensions of them, just because it's just really hard to provide long-term support through a charitable fund. So a lot of our work, from a nonprofit perspective, goes into ensuring that payer sources, that therapists can take more insurance, that clients are hooked up with potentially a form of insurance that would be adequate for their needs. But again, the whole health insurance landscape, the Medicaid landscape is quite difficult. So we just do the best that we can. And, that's where those extensions come in, just to provide a little bit more. We do, have some interesting exception criteria for our scholarship program. If an individual does have an established relationship or of 3 or more sessions with the provider, and they do have good insurance, we ask them, would you be willing to switch providers and use your insurance? If they say no, we go ahead and make an exception just because of that established relationship. And we, recognizing that rapport and recognizing that creating that connection, is something we don't want to burden the client with doing all over again. We do have a couple other exception criteria, specifically if it takes time for perhaps, there's a 3 or 4 week wait, for example, with their Medicaid provider, with the clinic that accepts Medicaid. We do make exceptions if care is needed sooner to access therapy. If a client additionally has done a lot of due diligence, has tried a lot of different modalities, and is specifically looking for a very particular modality that their insurance doesn't cover, or they don't have a provider in network that has that modality, if they do demonstrate, that due diligence, then we do make an exception and offer a scholarship as well. So there's just some background on kind of how our scholarship program functions. Referrals are very simple. They come in from different agencies and different clinics, nonprofits, and they come from therapists directly as well. I will say that there have been times when a therapist has referred a client presuming that they would get a mental health scholarship, but we find that the client didn't know they had a valid payer source, a viable payer source, and we end up referring to another therapist. So we always clarify to the therapist that, hey, we're not poaching your clients. We're just making sure that the client gets sustainable long-term care, which is, best for everybody, best for our scholarship program and best for them. So just be aware that we do that level of vetting of, any potential payer sources, and that we will refer to, first and foremost, any viable payer source before issuing a mental health scholarship. So that's definitely something that, we just have to do to preserve and safeguard and just, how do you say it? Just, act in fidelity, to our funding, just to be really true and authentic to the nature and the source of our charitable funding. So all that being said, I think I can just provide a few interesting data points. We don't have anything super recent, but we did do some analysis around the COVID times, and you'll see specifically how our scholarship program and our services spiked during lockdown. So hang on just a second while I pull that up. So as you can see, this is a kind of a chart of starting in August 2019, the number of clients per month really started going up in that COVID timeframe just after lockdown, when people really settled in. Same thing with individual client touch points as well. As you can see in August, September, these touch points and the number of clients really went up. That being said, we'll move on to scholarships issued per month. And scholarships issued per month is very interesting. So as you can see here, we kind of we're going steady for a little bit of time, and in the winters they usually go up. In the summers and in mud season they're kind of down. In the winters, you know, they're going up. And then of course over here you can see in the April, May, June, July timeframe there was a significant increase in scholarships issued. And just another interesting, where did that go? Hang on just a second, please. Yeah, and we'll just look at scholarships issued by gender as well, which is always an interesting data point. We see primarily females, about 70% females utilizing our program, and the rest male. Very, very few non-binary transgender folks using our scholarship program, of course. But yeah, this is an interesting one. And I believe by race as well, we can see primarily white, of course, Hispanic, and other races much lower. And again, you see in that May, June, July timeframe, the amount of scholarships increasing. And the last thing I wanted to share here, yeah, let's do this one. Here it is. Yeah, so we pretty much have just seen our scholarship program grow very significantly. This is a little bit of an older graphic here that we're using for marketing our program and showing results. But yeah, so right now we're closer to 2,000, definitely closer to, you know, maybe 10,000 plus sessions. And, you know, we definitely have more than those 40 therapists at this point. But primarily, I think down here, just scholarships by age is definitely an interesting metric. So you see, you know, people in their 20s, 30s, 40s. We do have a growing number of adolescents as well that we're very proud to serve. And so this kind of gives you an idea as to who's utilizing our program, how it's being utilized. So I think that covers the majority of what I wanted to share as an overview of our program. Just wanted to reiterate how proud I am of Connect to, you know, be taking on an initiative such as this. We have just seen some really incredible, really beautiful outcomes based on the impact of our program. It is quite hard to get folks that use our scholarship to complete survey data. I really wish we had better survey data. But what I'm going to do is I'm just going to read a few testimonials. And let me see here. I think that this is the wrong document. I apologize. I'm going to, I'm gonna dig that up if you don't mind, and I'll read some really
Take your time to do that.
Yeah, inspirational testimonials. But I'll I think at this point I'll hand it back over to Julia, our therapist, Cindi Harris-Krane, who will be representing, you know, kind of our provider community. With her experience with our scholarship program, should be joining shortly.
Thank you so much, Ravi. I love the graphics, obviously, because you can see the impact. It's so incredible to see how many people you've served, and the age groups. And I mean, it just really hits the point home that these mental health scholarships are really important in your community, and it's inspirational for us. You know, I'll ask just a couple questions here. In starting your programs, or even as you've gone through and have a few years under your belt, what would you advise us that some of the challenges could be as we're launching this? Any ideas, or even what, are there any challenges that we should be sensitive to regarding how, providers kind of integrate this into their world? Any advice?
Yeah, that's an interesting question. I think one of the challenges that we faced was the overwhelm of clients that
Yeah.
came to us once kind of word of mouth spread like wildfire about our program. Uh, we've also certainly, in a way, helped support the private businesses of our, private practitioners in Summit County.
Mhm.
We've always tried to be clear that our program isn't meant to be a major kind of business boost and not to depend on it for, keeping your business afloat, keeping it solvent, as referrals can definitely ebb and flow. So it is really important that providers do have kind of additional revenue sources than a scholarship program itself, which is why we emphasize insurance and Medicaid, et cetera. I think one of the other aspects that we came across was about 56%, I believe is the number, 56% of people using our mental health scholarships had insurance. We initially never really looked at insurance as any real option. The primary folks providing services through health insurance were the local clinics, and they were always on a wait list. And so we would just routinely, issue scholarships to folks that had insurance, and we really decided that we needed to change that and just improve the mental health system as a whole. So we contracted with a biller and a credentialing entity as third-party vendors that we paid for their services for our private provider community. So we went from maybe 3-4 private providers that took insurance to close to 50 or more at this point. And that really changed the landscape of accessing care. Definitely, our scholarship program, especially with COVID, we were hoping to see that it reduced kind of in terms of impact. In terms of utilization, we were hoping to see that our scholarships would go down, but due to COVID, both insurance usage and scholarship usage really went up. And we're continuing to see, the effects of COVID on mental health and, positive effects on destigmatizing mental health as well. Just because so many people that really came up, to the forefront of their experience during COVID. And with so much advocacy around COVID and mental health, we just saw both our scholarships and our insurance usage increase. So I think that as your program grows, you'll potentially want to head off the insurance aspect more intensely or more intentionally. And just doing more investigation around that so that you can refer appropriately, make sure that any unnecessary impact to your charitable fund is mitigated by using health insurance or Medicaid.
Wow, that's great. And I'm wondering, how many people does it take to facilitate this type of program? How many people from Building Hope are actually involved directly with the scholarships?
Yeah, so we have one full-time person, myself, and we have 2 part-time people in case there is kind of an influx of requests for issuing scholarships. I do look to some other part-time staff for that. We do have actually 7 issuing sites. We have trained 7 different agencies / nonprofits in issuing these scholarships. So one of the other things around access, was we wanted there to be a no wrong door policy. And so, our larger nonprofit here, the FIRC FERC, which, has thrift stores and food banks and health insurance, enrollment services, health navigation services, family support services, et cetera, et cetera. They're issuing scholarships and they're a very valued partner for us. We were actually incubated within them in 2016 prior to starting. prior to becoming an independent nonprofit. And of course, the Advocates for Victims of Assault, that supports domestic violence, sexual abuse survivors. They issue scholarships. Our Mobile Crisis Response Unit issues scholarships. We have, our clinics issuing their own scholarships as well. And so one thing that I would potentially, urge as well is to just have a really good data tracking system, just to make sure that you're able to report for grants in case, that's part of the source of your funding. And also to just make sure that the people issuing those scholarships are very well trained when it comes to investigating insurance and making sure that that's part of their process, just to ensure fidelity to the program.
Yes. Lots to think about. Wow, I'm so impressed with how you've gotten this. It sounds like it's seamless at this point. So I will hope for that. Maybe not in 3 to 6 months, but we'll we'll be striving for your success. That's for sure. So thank you for those answers. And I see that Cindy has joined us. Hi, Cindy. I'm Julia Sembrat with Connect Summit County. I'm the executive director, and I'm thrilled to have you here. Cindi Harris-Krane, and you are a provider with Building Hope. And I'm going to tell our audience a little bit about you. You've been in private practice in Breckenridge since 2012, following graduation from Capella University in December 2011 with a Master of Science in Human Services with a specialization in mental health counseling. Cindy's experience includes working with clients on a variety of issues, including, but not limited to, anxiety, depression, ADHD, anger management, grief and loss, and trauma. Cindy was a contracted therapist with Independence House Outpatient Treatment in Denver, Colorado for 7.5 years, working with diverse populations while also in private practice. She has been a Summit County, Colorado resident since 1998 and initial coordinator for the Summit County Parents as Teachers program, as well as the developer and coordinator of the Safe Exchange program, which provided healthier transfers of children between discordant parents. While residing in Santa Fe, New Mexico from 1983 to 1998, she was in the fields of early childhood education, elementary education, fitness, and outdoor education. And Cindy is licensed, she's a licensed professional counselor, national certified counselor with Master of Science. And you've been a provider with Building Hope since its inception. So you really have some rich experience here, and we're looking forward to hearing all about that, Cindy. So thank you. We're very grateful to have you here today. Thanks for taking time. And why don't you tell us a little bit about your experience with Building Hope, and probably have some questions for you after that. Cindy, you will have to unmute.
Got it.
There we go.
Okay, great. So, yes, so first of all, I'm at home, so there might be the occasional cat or dog in this, which I
We
see.
always teach your pets, so not a problem.
See that as a positive addition. Yes, I started out with Building Hope from the beginning because I felt that it was a crucial program for the community, and it's had a major impact, as I'm sure Ravi has provided, some of the data on it. As a practitioner, I feel that it has really created an easy opportunity for people to come in and see a therapist, many of whom would never have considered doing that before. And again, the ease of the process, I think, is very central. when you speak to someone, any of the ways in that Ravi was talking about, you are speaking to someone who is so available to you to help. They've really created an open, friendly, caring, and genuine environment when someone calls them, okay, or goes through one of those other avenues to sign up with them. I see a huge change in the community because of Building Hope. I think there's been some significant destigmatization of around mental health. And I think that people are having a whole new experience of, wow, there are these really nice people in the world. Because for so many people, they're dealing with a lot of hostility, unfortunately. Whether that's coming from their workplace or their friends or their relationship. And for them to have a different experience when they get in touch with Building Hope or they go in to see a provider I have seen life altering. As far as Building Hope and how it has evolved, I think it has evolved in really important ways into a sustainable nonprofit. And Ravi spoke on this a bit. It took some adjusting, I think, for some of us who had started out in the beginning where it was just, anyone and everyone, and there weren't questions about insurance and, but as Ravi said, they contracted with billing. First, they started with one billing company, and now there are two. And that made all the difference as far as I was concerned. And so they also made it easy as a provider to become enrolled and on board with different insurance companies. And they worked directly, with the insurance companies, the billing people, to bring this all about. And so they really, really strongly support the providers. And my experience has been that they really get us. They really get the challenges that we face. They really get that for many of us, the billing piece, that side of things isn't really our forte. Ooh, bless you. That's not really why we got into this. We're in the business of helping people and holding space for people and really making a difference. And so when Building Hope stepped up to help the providers, it was a huge step, made a major difference. So,
Wow.
those
Yeah.
are my thoughts on Building Hope, and I'm happy to answer questions.
I have a question. Hi, my name is Kathy. And we have a small group today, and that is, one of it's just an interesting thing. It's hard for us to generate a lot of enthusiasm sometimes among providers in our town. And I so appreciate you being here. And I'm wondering if you have any ideas how we can bring them in. And this was so helpful to say it helps us with the business aspect of our practices. Like that's a huge takeaway for me, just that. So thank you. But are there any other avenues or ideas that you might have that we can, in this hard time of COVID, where everybody does feel overwhelmed, so we're starting at a very different time than you started, but we want to bring this out to the community and get providers excited?
Okay. Well, I think one of the things, and this isn't maybe the first step, but well, part of your reaching out, okay, which we can talk about avenues, and I think Ravi can talk about that too. Um, but I think the more information you provide, um, for example, you know, anything that's vague, right, requires someone to look further into it. And sometimes, we just have too many other things, going on to take that next step to look further. And so the more information you provide at the get-go, okay, the better. Does that make sense? The details. I've seen that, for example, with like Vail Resorts EAP program, Corey Levy, he just really provided in his outreach, all of the details and the information, and making things as easy and simple as possible, of course. And so as far as though getting the word out to therapists, I certainly think that, that Building Hope is going to be one of your best avenues, because they have, really, gotten in contact with therapists. Now, so you all are specifically Summit County?
So Summit County, Utah. So there are twin over a state over.
Oh, I've got it. Okay, great. So Ravi, how do you think that you guys did the best at being in touch with therapists, getting them to listen?
Yeah, I think Betsy Casey is the founder of Building Hope here, and she did a lot of legwork. She really did a lot of personal kind of calls and meetings with providers to just get them to be open-minded about a program like this. I think here in Summit County, Colorado, a lot of nonprofits kind of similar to Building Hope had kind of come and gone. And Building Hope has really been, as Cindi said, one of the first sustainable ones in a while. So Cindi, do you recall talking to Betsy in those early days and what that was about?
I sure do. So for me, one of the ends right off the bat was that I knew the Casey family, and I knew where this was all coming from and starting from. And so, that made me particularly interested in jumping in. But I also remember that there was a big, they did a big poster campaign around, all around Summit County. And they had a provider / community meeting. Ginny Bradley, who does so much of that here, facilitated that meeting with Betsy. And that was before COVID. And, they invited all of us, they invited every therapist that they could find. A lot of therapists can be found through psychology today, as far as, finding therapists in your area. And so that is absolutely one way to go. And then, of course, those therapists can reach out to others. So there's that aspect of it.
That's a huge help. Just that we need to get a core group of therapists, and we're small enough that we can do that. But you mentioned it, COVID has thrown such a curveball, as far as people's ability and just bandwidth to take on what they see as more.
Sure.
Yeah, and Kathy, I'd just suggest, community, like getting that level of community penetration just requires a lot of groundwork and grassroots kind of community building work. So just as it goes generally, it also goes for provider and therapist communities. So feeding them is always great in a central location. We do, as I mentioned, those provider mixers. They get one drink ticket and dinner and ample time to just talk and network. So that might be a good way. But yeah, Cindi did mention we did do a pretty significant stigma reduction campaign. We had contracted with an organization called Cactus, which is a kind of a higher end marketing company. They created a lot of colorful, creative designs for us. We put them up on buses, on bar coasters and coffee cup sleeves and in different public places in the community. So we were just really kind of well, just known. So
those are great suggestions. That's fantastic to hear that. Rachel, was that you?
Yeah, I want to jump in real quick. Mary is with us, Mary Carba. I think I'm saying your name correctly. So Mary's with the University of Utah, Utah Behavioral Health Plans. And I'm really grateful that you were able to join us today. Mary, I just wanted to check in and see what your reaction is, or if you have any questions about
it sounds great. I think it is a great program. And I'm excited to help. I hope I can help roll it out in Summit County. I think the idea of getting a core group of providers is key in this effort and the legwork. The only thing that's hard is with this type of providers, therapists, it's hard to get to them unless you set something up. You can't just drop in their office because they're in session.
No, that's true, and that's good feedback. As I get into my position here, it is the providers are key, and so we are in addition to other clients that come into Connect, we are very much strategizing to meet people like yourself, Mary, and really get to know the people who are doing the work here. So, but as everybody else, our cup runneth over, is trying to make that time. We're carving out that time because it is important. Yes, and I've started with my own therapist. Like, hey, we've got this wonderful program. So slowly but surely, I know we're going to build momentum, and it's going to take time. But and I should mention, Kathy is one of our wonderful board members who does so much for this organization. And Kathy, thank you. And with the effort of the amazing board that we have and staff, I'm really looking forward to seeing how things look at the end of this year as opposed to right now, this second, because I know that this is just so key to the community right now. And you've proven that, both you and Cindi and Ravi today, you have absolutely hit that point home, and it's so inspiring. So, and we're happy to be your sister organization as well. But in the interest of time, Ravi, you mentioned that you had some testimonials to leave here on a really high note. I'd love to hear what some of your participants have said. And again, Mary, thank you so much. It's nice to see your face again. I hope to meet you in person. But Ravi?
Yeah, absolutely, Julia. Thank you. Yeah. So these are some pretty beautiful and heartening testimonials. I'm going to paste them in the chat so that everybody just kind of has access to all of them. I'll just read, hang on. Yeah, there we go, sorry. So it looks like it's only letting me paste a little bit of it. Sorry for the technical difficulty. So that's the first half. And I'll just read a couple of these. So yeah, it has saved my life. I would not have afforded therapy otherwise, a sweet and short one. I think it is extremely valuable and a wonderful help for me. I never would have gotten the help I needed if left to my own devices. A little bit of a longer one here. This is such a valuable program. I was so anxious and depressed and not really functioning or able to be kind to myself. And with months of therapy, I was able to identify unhelpful patterns I had for so long. I didn't realize they could be changed. Stop beating myself up and start relaxing and approaching everything with more love and acceptance. I still have a ways to go, but I feel better than I have in a long time. So many of us want to do therapy, but don't because of the cost, and the process seems so overwhelming. This program has been a lifesaver for me and some of my friends who've also gone through hard times, and were able to access help because of Building Hope. Until we can have universal healthcare that makes therapy free and easy to access for everybody, programs like this will be essential. Thanks so much. And maybe just another one or two. This is an amazing program. It was easy to access with low barriers to entry, and the program scholarships were simple to understand and readily available. I'm incredibly grateful for this program. I'm incredibly grateful that this program was available to me, and will continue to recommend it to others in the community who may need therapy. 5 stars. And let's see, my husband and I needed couples therapy to help us through a difficult time, during which we were also using our health insurance for our own individual therapy sessions. The cost of our individual and collective treatments were becoming unsurmountable, and we would not have been able to continue without Building Hope's help. We are so grateful for the assistance of Building Hope and our therapist during this time. Thank you. I'll copy and paste a couple more of those that didn't fit in my initial message for people to peruse through. But yeah, there's just some really heartening stuff here.
Yes, and thank you for sharing that, because I think that that's part of our rollout, is people need to hear from participants how this has really positively affected their lives. So I thank you so much for sharing that. And before I just kind of wrap things up here, does anybody else have any questions or comments at the moment?
I have
So
one quick question,
yes.
just while I have you here. Something else that kind of grabbed me was that I think on the flyer, you had a percentage of helping clinicians get their hours for licensure. Like, I think that, so that's intriguing to me for our community, is if we have, CSWs or folks that aren't licensed yet, to pair them with a therapist to help them get their hours and help more people. So that, if there's any comment quickly about that.
Yeah, we do have a special mini grant program. It's part of our larger programming, where we provide up to $2,000 of funding for providers to expand their capacity. Perhaps they want to become a play therapist, want a synergistic play therapy certification or EMDR certification. Certainly for providers who are looking for licensure, supervision is quite expensive. So we do allow those mini grant funds to be used for supervision. Our requirement is that they be in the community for at least 2 years, and using that actively. If they leave, they would have to pay us back.
That makes sense. Thank you.
And we've given a ton of these mini grants out. We actually even give them for different support groups that therapists want to put on. And so we increase access to care in different ways.
Well, thank you so much. And Mary, I will say to you, thank you for showing up. We appreciate you. And, one of the things that we want to open up when we have a little bit bigger group is how can Connect serve you as a provider. We'd really like to know, what can we be doing for our providers that will help alleviate a little stress, or help you in ways that we don't know you need help. So I may be reaching out to you individually just to get some thoughts and to connect with you. But again, thank you for being here. Rachel, anything else, or?
Yeah, I think just a quick note. So I hope that anyone who's watching this video would please consider joining us on February 15th and 16th for our State of Mind event. It's a virtual symposium supporting the mental health of Summit County. So we'll have 4 panel discussions over 2 days.